okay, well, instead of a 10% rate increase, you're going to get a 40% rate increase on the entire group. Because we got to cover Bob's risk somewhere, and free. So we do not, with any of our captives that we've interviewed and have agreed to be a part of the National Alliance Star Captive Program, they've all agreed to a no laser policy. Again, it becomes a business decision, the same decision that you would make if you're fully insured going to self-funded. The reason you join a self-funded health plan is because you want to have change left over and you want to have that benefit, right? If you develop 2 or 3 of those ongoing chronics that are going to cost $500,000 a million, you've kind of lost the value of being self-insured. The difference is you're going to have data, you're going to know, we're going to try, can you manage $1 million to $800,000 with some different programs? Yes, but even still, you're going to eventually have what we call the adult conversation to say, this isn't working. It's not because the captive was bad or self-funding was bad or level, it's because you just got stuck in a bad situation. And you're never going to win. You're never going to get change back. So maybe you go back fully insured. If we have claims data, we're going to use that. If you're under 100 and you don't have claims data, basically what we're doing is we're asking for census, plan design, all of that, but we're asking for your current renewal and your prior renewal. If you got a mid to low teen or single digit increase, you're a good risk. Okay? I mean, carriers don't lose money on they know how to rate groups. If you got an 8% rate increase this year and a 2% rate increase the prior year, we know you're a good group. If you got a 30% this year and a 28% the prior year, we're not going to give you a quote unless there's some reason that 30%, that risk is no longer there. So we're kind of shadow pricing. But where we can get claims data, we would like to have claims data because that helps us better identify what the risk is. And we can also show you kind of what the chances are that you're going to get money back. So let's play the what if game. So this is someone who joined the captive compared to had they stayed fully insured and paid $1 million in premium. So $1 million was going to be their fully insured premium for the year. And they joined the captive. $200,000, that's administrative expenses going to the TPA, for the PPO network and all those things. That's a fixed expense. You're going to pay that time divided by 12, but you're going to pay $200,000 whether you have claims or not. $200,000 is going into that shared captive layer this is your portion that's going into that shared insurance company. So there's $400,000 that is fixed and it's going away. Gone. The rest is left over to pay your claims. So in this year, you had $650,000 or 65 cents. You had $650,000 in total claims. $550,000 was in your claim bucket, your 0 to 25. You paid that. $100,000 came out of the shared captive layer that you paid into because you had a couple people go above $25,000. But you didn't pay that $100,000. The captive paid that $100,000. So your expense, your claims expense that came out of your self-funded health plan was $550,000. So that was your $550, your $200, your $200. It was fixed. You spent $950,000. Compared to $1 million in fully insured premium, you had $50,000 left over. 50 cents or the proportion of 50 cents out of your change. Here's your change. There's your change back. Sound good? That's you being in a self-funded employer, being in a captive. You're self-insured on your own. Now the captive portion that you paid into, here's your 10 buddies. You all paid in a total of $2 million. That's what you totally paid in. You paid in $60,000, you paid in $80,000, you paid $150 based on your risk. But as a group, you had $2 million in there to pay claims that went above each group's self-insured layer into that claim bucket, into that captive bucket, into that captive shared layer. So $2 million was put in there to cover claims in between self-insured retention layer, and $300,000. As a group, there was an 80% loss ratio, or you paid out $1.6 million. There's $400,000 left over in your shared layer. You had a good year as a group. There's $400,000 left over. Depending upon the captive, but most of them are member-owned, at the annual meeting or the annual call, they're going to come to a vote. They're going to say, folks, we had a pretty good year. We've got $400,000 left over in our captive. Woo! What do we want to do with it? We want a dividend. All in favor of dividend, say aye. Everybody votes, yep, you get a dividend. Your prorated portion was 7%, so you get 7% of $400,000, you get $28,000 back from the captive. Somebody else, their prorated portion was 10%, because they paid more in. May have been a bigger group, paid more in, so they're going to get $40,000. Group says, nah, dividend doesn't work for us this year. We're a little concerned about our claims as we see them this year. We want to let it ride and build up a reserve for next year in case we need it. All in favor say aye. Everybody votes. It gets carried forward. Captive ownership. You have a voice. So when you look at that and then go back to Company A, here's where you were on your own. You're $950. You had $50,000 back. Here's your $28,000 distribution. Your net cost was $922 because you got $28, so you have $78,000 in total savings. This is why you go self-funded, because your biggest chance to win is here. This is where you want to win because it impacts you the most. If your 85 cents that you set aside comes in at 50 cents, you've got 35 cents left over. If it comes in at 70 cents, you've got 15 cents left over. This is where you want to win. It's kind of nice and cool when the captive has a good year and y'all get a little bit of money back. That's kind of neat. It's kind of cool. In the captive bucket, you're right. But if you were the super healthy plan and you had only spent $300,000 instead of $550 because you had that super healthy year, that extra $250,000 is in your account. It's not, again, it's not in a fully insured carrier's account. You had that super healthy year fully insured, and if you knew that you only had a 50 cents on the dollar loss ratio, you don't get that money back. They keep it, and they give you a less bad increase. When you're self-insured, you have that super, super good year. That your account, your big chance to win is big. Now, truth is, actually, 1 out of 5 to 7 years, you're going to have that, oh my gosh, we did so great. And it wasn't because your wellness and risk management was the greatest in the world. You got lucky. Hey, one in every 5 to 7 years, you're going to have a lucky year. 1 in every 5 to 7 years, you did everything right and you got hammered. You had this catastrophe, this catastrophe, this catastrophe, this catastrophe. And you are the butt ugly one showing up at the annual meeting, and you know you're Company F, and you're walking in there. Now, thank goodness nobody knows the companies and their things. You do. When they talk, yeah, Company F had a bad year, and you're thinking, don't anybody look at me. That was us. You know? Yeah, you know, but the next year or 2 years later you go and you're Group B and you're the shining star and you're walking in there going, what did you do wrong this year? Come on. Well, that was us 2 years ago. Okay, that's the risk and reward, but that's what you're paying into. But that protection, that when you do have that really ugly year, there's somebody else there that's going to have a really great year and they're going to help pick you up. What you're trying to do is minimize the 25% rate increase out of nowhere. The average increase of a captive's altogether is around 5 to 8% average. Some get 12, 14, some get 2 to 3. What you don't want is you're bam! You can't manage to that as a business owner. You can't do that. You need some stability. We need to squeeze the peaks and soften the valleys. And that's what being a part of a captive is about. Questions? You guys are asking great questions.
So how many captives do you actually make available, have available for this offering, and how long have they been?
So we have 5 different captive managers that are a part of the National Alliance Star Captive Solutions. One of them, full transparency, I'm not real happy with because they put us in an incubator new captive, so we probably won't sell a lot of that. They're a really great captive manager, but they put us in kind of a new captive, and I told them, I said, I don't think that's going to work. So they're one of the 5 right now, but I don't think we'll sell a lot of their business. The other 4 have all been around for a minimum of 7 to 10 years. And we're putting together a captive, kind of a spreadsheet that shows the different, it won't say who the captives are, but the different captives, how many years they've been in business, who their carrier is, how many employers, how many employee lives, what their average increase has been over the past 5 years, kind of a frequently asked question on the captive options. So that, I'm waiting on a couple answers back from a couple of captive managers. That'll be ready in the next week. That'll be available to Matt and Shelley to share for anyone that wants to see.
What do you think the optimum number of lives for a captive, to achieve a stride goal?
You know, I don't know that there's a magic number. What it really comes down to is this, is when y'all come together and try to make business decisions, can you do it effectively? So you could have a group that has 250 companies in a captive, and they're captives that are that big. We don't work with those because we think there's benefit to being in smaller, more intimate captives that you get to know each other. But, you know, I mean, the size, the largeness of it really doesn't matter. What we look at it as, when you're making business decision for the participants, for the members, is it something that everybody feels that they've got a voice in? Or has one agency put in 20 groups in a captive that has 40 companies? And those 20 groups with that agency, they're really kind of running the captive. That's when you go to that agency and say, I think it's time you go start your own. Because you're trying to do good for everybody. And when you have one large entity that might be representing a bunch of different companies, they tend to run the business. And that's not what you want. So I don't know. The answer to your question is, in our opinion, size, I'm not going to say it, but you know where I'm going. Size doesn't matter because it really comes down to the makeup of the group and can they work together as a captive. When we get the information into quote, we'll talk with the broker and kind of learn about the group. And, you know, some may be well advanced with wellness and risk management strategies and doing things. And they may be better suited for a certain captive because the other members are like that. Or someone is saying, yeah, we've tried to do some wellness stuff. We'd like to do more and we need some help. And we like the fact that there's some help with this. They may be a better fit for with other people that are kind of like that. So we kind of talk and kind of get the feel of the character and the culture of the organization and try to make a good fit that way. But, I mean, ultimately it comes down to the broker, advisor, and the employer as to, you know, which captive they would choose to participate in. Questions? You asked this question. What type of wellness and risk management is built into it? So there is risk management consulting and wellness program coordination, and we support that out of Arkansas with our team. There is data analytics that's collected on all of the groups and on your individual group. So again, depending upon your interest, your size, how frequently, but every quarter, every 6 months, there's a very detailed key indicator population health management report that's shared with your broker that's presented to you as to where your problems are, chronic conditions, how many people are taking 6 or more prescription medications and how are they impacting your cost, is your musculoskeletal claim starting to go out of whack, and those types of things. So that information is shared with your broker and then is shared with you. So that data analytics is included. Transparent pharmacy benefit program with 100% eligible rebates returned to the employer. Big. A patient portal with health education tools, and then where they're available, high-value provider networks, direct primary care physician, direct contracting with hospitals and facilities. Patient concierge services, this is a huge one. And a patient concierge service in this program works like this. It's a 1-800-HELP-FOR-ME number that you have as HR, but for your employees and their family members. I made up the 1-800-HELP-FOR-ME, but that's kind of what it is. It's if you've got a question at all about your benefits, you've been told you need to get an MRI, you've been told you need to do this, you need to do this, anything non-emergent, people are confused about how to access health care, call 1-800-HELP-FOR-ME and let them help you navigate through your benefits, maybe help you find a better provider at a lower cost so that you spend less money out of your pocket. That concierge service is included in something that we promote heavily to the individuals. It's a benefit for you if you're human resource people, because if you have someone come in and want you to check a claim, and that's the role that you like to play, you can call the concierge service and dump it on them, and they'll go investigate it and call you back with the answer. So this is a very, very important piece to help people navigate a complicated system, to help them save money and get them really, really great care. Zero copay telemedicine. We want to eliminate cost barriers where we can to have people have access to care. So having access to telemedicine services with zero copay, whether you're in a PPO plan or an HSA plan, let people call and talk to a doctor, get treatment if they can, let that doctor call in that prescription and go get it picked up. Don't put off something because of cost. So telemedicine is including no cost diabetic testing supplies. There you can see all the rest of the stuff. We're always looking to add to this, to the benefit of the patient, so that they can get the best possible care with the best outcome possible at the lowest possible cost. And for the employer, because if we do a good job managing this risk and people take advantage of these programs, there's going to be less money coming out of your claim bucket and less people going to the doctor. You all have the PPO connection, correct? Or not PPO, the pharmacy. The pharmacy program would be the program of the Kansas Business Group on Health. We have a preferred telemedicine vendor, but we realize that brokers sometimes have their own favorites. I don't care who the telemedicine vendor is. It's going to be zero copay and people are going to know how to use it and take advantage of it. So we can carve in, carve out. This is a bundle, but as long as these services can be provided by either a coalition or a broker that has a relationship or a PPO that has a relationship, we just want to make sure these risk strategies are out there, they're implemented, and that people know about them and that they use them. And we build a plan with them. We go out and sit down once a year about a communication strategy and how we're going to promote these types of things, and it's ongoing. So we're constantly, and then we kind of every year give them a scorecard as to how well they're doing. Not to smack them on the hand, but to help them move forward. Again, where they say, we're not going to, then we're going to kick them out. If they're wanting a quote from us, they're going to get our stop loss quote. So they would market it to us just like they would anybody else, and we're going to be a solution similar to what they would present to someone else. So they don't have a say in who the stop loss is in this, but we're a stop loss provider as a part of the captive. The captive managers do. We don't, but the captive managers do. The concierge has all of the benefits, all of the programs built into their system, and they become an intimate customer service connection for that employer with the TPA to understand their benefits. Okay, let me rephrase that. Do they have all the fee schedules? No, but they have a big chunk of them, yes. And again, they're there to take the work off the patient. If a patient says, hey, my doc, see me hobbling, and my doc says I need to get an MRI on my knee, and they call 1-800-HELP-FOR-ME, and they go, I don't know what this is going to pay, and how much is it going to be out of my pocket. They'll get the information, they'll pull up, they'll have access to, or they'll say, well, let me call and get back to you. But they do all the work, and they'll say, hey, where you're going is going to end up costing you $650 out of pocket based on where you are with your deductible and your coinsurance. Now, there may be a couple of other options in your area that provide the exact same service with the exact same outcome, and it could possibly cost you less. Would you be interested to know about those options? Might cost me less? Yeah, I'd like to know about those options. Great. Would you rather go to an MRI facility that is closer to your home or closer to work? I'd rather go where it's closer to my home. I do it at the end of the day. Great. They find out where that is and they go, let us do some research and we'll get back. They call you back. Hey, Bob, good news. We found 2 facilities close to your home. One's 3 miles away, one's 7 miles away. If you go to the one 3 miles away, instead of $650, it's going to cost you $500. If you go to the one 700 miles away, it's going to cost you $400 instead of $650. Which one would you like to go to? Well, yeah, I won't read that story. So they go, I'm okay driving a little bit farther. Okay, would you like a morning appointment or afternoon appointment? I like an afternoon appointment. Again, at the end of the day, what day is good for you? Well, Thursday. Okay, we're going to call and see if we can get you an appointment. They call to make the appointment, and they call back. You're all set, Bob. You have an appointment Thursday at 4:20 at this facility. Here's what your out-of-pocket cost is going to be. We'll follow up day after to make sure that everything went okay. That's a concierge. That's what takes place. It's worth the $2.50 per employee per month that it costs to be in this program. That's all it costs. Great. All of our quotes are $12.15 or $12.18. We don't play the 12-12 game. They're all $12.15 and $12.18. And why? So that's important. So the what's next would be would be for you to tell your broker consultant, hey, I was at this seminar with the Kansas Business Group on Health, and I heard something that I'm kind of interested to know more about. And I'd like to know more what it would mean for my company and what I need to do to really understand. And your next step is to contact Shelley or Matt and say, we would like to have a meeting, or we would like to set up a phone call, and we'd like to talk to learn more about how this program works for us and what you would need for us to put a quote together. So that's really the next step, would be to advise your broker consultant to reach out to Shelley and Matt and to say, hey, they were at the seminar, and I'd like to find out more for their benefit. There is a bonus benefit for an employee benefit captive that's well managed and well run. If you're participating in the wellness and risk management, your workers' compensation costs will go down. Because while we intentionally put them in silos, workers' compensation and health insurance, if you're a healthier, happier employee that's in better shape, if you get hurt, you're going to return to work faster. And if you're in better health, you might not get hurt at all. So the bonus of being in a self-insured health plan. But in our programs, a self-insured captive that involves and includes wellness and risk management strategies, it will have an impact on your workers' compensation. So we don't manage any captive pools. What we have done, we have 5 captive managers, one of which I will tell you we will likely not put any business with this year. So out of the 5 we have, Pardon? Spring Consulting. Yeah, you haven't heard of it. So we have 4 captive managers that again, all have different strengths and different ways that they go about things that we are representing right now.
Do you have any summary data on how this impacts the captive members in terms of every time they have self-concession % savings, or anybody you can tell us about that?
I mean, I can tell you that the captives that we're representing for members that have been in it for 3+ years, they've won more than they've lost. I mean, it's worked for them from a self-funding standpoint. Has the captive always paid a dividend? No. But again, you don't join a captive to expect a dividend from the captive. You join a captive because I'm a little scared to be self-insured on my own. I want to be a part. I want the advantages of being self-insured. I want to own. I want to change. But I want some protection that if I have a bad year, I got somebody there to pick me up. But you join a captive because you want to be self-insured. And you want to be self-insured with other people who help you. And so, again, it's a stay the course decision. Don't do this as a one-year decision. This is a strategic business decision that you're making. You don't just try self-funding for a year and then jump out. And if that's what you're thinking, don't do it. Stay fully insured. Look at level funding. Look at something else. But going self-funded, that's not it. You're making a strategic long-term business decision that we've looked at our history over the last 3 to 5 years, and for the most part, our rate increases have averaged single digits to low teens. I'm telling you, somebody made money on you. If you're fully insured, somebody made money on you over the last 5 years if you've had low teens to single digit increases. If you have claims data, we can certainly show you where your claims were, where it might have been in a captive, and what you would have won from your claims bucket. But it really simply comes down to this. If you're fully insured and you've averaged a 12% rate increase or less over the last 5 years, you've made somebody money. You're a good candidate to look at being self-insured. Doesn't mean you go self-insured, but you're a good candidate to look at being self-insured. Because why leave that change in somebody else's pocket? And the question comes up with this. Well, if I only get a 7% rate increase from a carrier, what rate increase are you going to give me if I had 20 cents left over? Well, let's think this. The 7% rate increase on the dollar here, when you only spent 75 cents, somebody kept your 5 cents and you still went up 7%. You get nothing back. You kept your 5 cents, and I still give you the same 7% rate increase self-insured. 7 and 7, no money. 7 and 7, you still have a nickel if you're self-insured. It's going to work out the same, the rate increase. They're going to be the same. The difference is you're going to be able to look under the covers and say, I'm not buying that 10% because I know what my claims were. You're going to have the data, you're going to know. But 7 to 7, 10 to 10, 2 to 2, the difference is you don't have the money in your bank account when you paid the dollar. You do when you're self-insured. You've got the change left over in your bank. That's another big difference in being self-insured when it comes to rate increases. Other questions? You guys ask great questions. Anything else? Questions? I'll be here. Obviously, thank you very much for attending, and hopefully this helped a little bit as renewal times are coming up, that you'll reach out to Shelley and Matt and say, hey, I'd like to know more. I'd like to know what this would look like for our group and whether it would be a right decision for us.